Hi, I'm Dr. Filidei. We've got a lot of feedback on Lyme disease and questions about patients' hits on the website as far as Lyme disease. It's Lyme disease awareness time. You might have seen a lot of things in the news lately about this. I see a lot of Lyme disease, and it's really occult, meaning a lot of people just don't get it. They don't think about it. The doctors aren't thinking about it. So I want to explain a couple things that might be of interest to you if you think you have Lyme, or if your life has been ruined by Lyme disease. So there are a lot of folks out there that really have had their lives taken away from them by chronic Lyme. First of all, you need to go to a Lyme literate physician. There's something called the Lyme wars. If you go to an infectious disease doctor, they're not likely to believe you, first of all, that you even have chronic Lyme. They don't believe it exists. And if you go to your family doctor, they're going to run a standard Lyme test, which is lousy. So you really have to go to a doctor that knows the testing pluses and minuses, with the hidden problems with testing. So if you have Lyme and your life is in shambles, there is hope. There are definitely methods to get you better. A few weeks of antibiotics are not going to do it. So we do multiple therapies that include natural and prescription that can get you better. It will take a while. It's a battle, but you have to prepare your body for this battle, and there are ways to do that. For those of you who think you may have Lyme, and that can be a lot of folks that don't know the symptoms. So the classic symptoms are pain and fatigue, but it can literally cause anything in the psychiatric book: anxiety, ADD, depression, odd physical symptoms, pain that's unusual. If you've had a problem that has defied diagnosis, you might want to think about Lyme disease as a culprit, or the co-infections. There are many bugs here, including something called Powassan virus, which you may have read about recently. Very dangerous and spreading. It's a virus, not a bacteria, but it's also tick-borne. If you think you may have Lyme, or concerned that you may have it and it's been missed, I'd like to point you out to a website you can go to take a test. And it lists several questions that kind of rank your probability of having Lyme. So Dr. Horowitz is a well-known Lyme doctor. He's written several books. And you can go to the website. If you just type in Horowitz and Lyme test, you'll come to this site, and you can do the test yourself. What you'll end up with, after you score all of your points, at the very end, is likelihood that you'll have Lyme. So you score a certain amount of points, and it may be more likely that you have it versus not. If your score is high, you might want to investigate that. Now, it can be hard to find help for Lyme. I do consults for patients all across the country. Even if you're not an AMN patient, I can make you an AMN patient via phone. We do an hour consult. I can send lab tests to you. You get them done, and we can figure this out. Treatment would vary because you really need to see someone to have things prescribed for you, but there are natural treatments you can do as well, sometimes even on your own. So if you're curious, interested, or aren't finding help anywhere, that can be done via the AMN clinic.